here you are in Vancouver, British Columbia. What brings you all the way over here across the pond and across the continent?
The Global Forum on Nicotine is an annual event that takes place in Warsaw, in Poland, usually in June. This year we're holding it for the 5th successive year, and what we realised was that we needed to start reaching out to people. As well as expecting people to come to see us in our house, we thought we'd better go to their houses and visit. And the reason we looked at Vancouver is because Vancouver has got a fantastic tradition of harm reduction. It's got the safer injecting rooms, it's a pioneer in those aspects of drug harm reduction, in prescribing services, in a liberal approach to drug laws. So what we wanted to do was we wanted to test how they would apply that approach to nicotine.
And did they pass the test?
They're in the process of taking the examination, is the way I would describe it. We're very disappointed that we were unable to hold a more public event due to certain pressure being brought on people not to invite various constituents that we would ordinarily have at such meetings. I think it depends on where you are. I think in the UK there's a bit more of an open approach. People may not agree with one another and they may not like the fact that they're in a room with people from another part of the business, but they accept that it's necessary, and also that you can't exclude the elephant in the room, which is industry. Mm-hmm. Industry will not go away. Industry is not going to allow its own Kodak moment to happen.
Seeing that you are sitting there at really the global level, give us a report card, just rating. We know that the UK is A-, an A, right? Around that. To the rest of the world, they're an A. B+. Oh, they're a B+. Fair enough. So, considering the UK is, in your mind, Paddy, a B+, what is Canada? What is the USA?
I think that in Canada, from what I understand in Canada, there is a general reluctance and a great level of conservatism within public health where nicotine is concerned. There seem to be an awful lot of attempts to conflate vaping with smoking and to actually incorporate measures for clean air and general anti-smoking legislation to actually incorporate vaping into those measures. And I think it's a very retrograde step. I think one of the bright sparks in Canada is that there's a growing and enthusiastic consumer movement amongst nicotine consumers with the Tobacco Harm Reduction Association, who, if they can actually continue the work that they're doing, they can have a massive impact. I think that the way that things have changed in many European countries and in the UK in particular is through pressure that's been brought to bear by vapers and consumers of other types of safer nicotine, because they will not be ignored, and they've actually stood up to politicians, they've stood up to regulators, and they will not go away quietly.
You know about that, as you know, we've been covering this issue now for 2.5 years, and one of the things that strikes me whenever I hear that, with regard to, okay, the consumers can make a difference, my mind, certainly now, is I want to know, please, point out to me and to our viewers an example of where public health on a national level listened to consumers and then backed down and changed or even canceled a major initiative that they had.
I think that what happened, rather than a confrontational approach, what consumers through various organisations, such as there's an established charity in the UK, the New Nicotine Alliance, which represents the interests of nicotine consumers. And I am actually a trustee of that, and the way that we've worked is to try and collaborate with the more open-minded elements of public health to challenge the more conservative elements. It's resulted in NNA being consulted on a lot of things, being told in advance of what is actually going to happen and being asked to comment on what's happening. We've got a very good working relationship with Public Health England. Public Health England has published the most definitive work on vaping and other nicotine products yet. They produce comprehensive reviews of the evidence and the science. It's been backed up by the Royal College of Physicians. there are other examples in the USA now. Even the Academy of Sciences is becoming at least less hostile, if not positive, towards vaping. So I think there's movement, there's positive movement, but there's a lot of work to do.